Hello and welcome, everyone. My name is Gabe Billiet. I'm a pharmacist here at KSB Hospital here in Dixon, and I'm here today on behalf of the KSB Community Wellness Services. And the kids are back in school, the weather is starting to change, so that means it's time to start thinking about flu shots or influenza itself. I'm going to talk a little bit briefly today about what is influenza, which is also known as the flu. It's an infection of the upper respiratory system. So the nose, throat, lungs, and most of our symptoms are going to be centered around, that area. It's a viral infection, and the biggest, most common side effects with it tends to be fever, cough, sore throat, body aches, more symptoms along those lines. It can sometimes involve a little bit of stomach issues or maybe a little bit of diarrhea, but that is commonly a different infection that we refer to as the stomach flu, which has nothing to do with true influenza. True influenza is, like I said, it mainly an upper respiratory, and so those are where those side effects are going to be. That weariness, that rundown feeling, headache, dry cough. Those are what we're primarily going to associate with a true influenza infection itself. A lot of those symptoms can mimic a cold symptom when they're first coming on, but the way to distinguish between those is that cold symptoms usually kind of come on a little bit more gradually. We start noticing it kind of throughout the day and just kind of a little bit worsening. Influenza tends to come on much more rapidly. It can last, several days or even in some cases a few weeks. It's primarily transmitted through airborne infection through droplets. With that cough, we cough out those droplets, those respiratory, particles that carry the flu virus with it. Now, this is a very preventable illness. One of the ways it may be prevented is through vaccination. Now, people will sometimes ask, what is the big deal with influenza, with the flu? It's been around for years. We've all had it at some point, and it's just part of our winter lives here in the Midwest. But the thing to realize is that most people do get better from the flu on their own, but it's some groups that are at higher risk of having flu complications. Those are the ones we're most concerned with. Young children, especially 12 years of age or younger, individuals with chronic health conditions, COPD, diabetes, heart problems, obesity, people that have had previous strokes. Those are individuals that are going to possibly have more complications from influenza that could have a more serious outcome with it and are more likely to be hospitalized with it as well. Other patient populations at risk would be people who plan to become pregnant or are actively pregnant or may give birth during the flu season. And then, of course, our elderly individuals. Now, another category that sometimes gets overlooked are those that may not be those high-risk individuals, but they have exposure to those high-risk individuals. If you work in a facility, nursing homes, in the military, as well as hospitals or clinics, you're encountering a lot of those high-risk patients on a day-to-day basis. So let's talk a little bit about how the flu spreads. As I said before, it's a viral particle that we pass mainly from person to person when we sneeze, we cough, even when we talk. A less common way to transmit it would be touching surfaces. An object that has the flu virus on it, could possibly be passed up to our eyes, our nose, our mouth, and those are ways that can get into the body itself. Now, once you have influenza, and again, this is what makes it so contagious too, is that you may be able to spread it before you even know that you're sick. Symptoms, begin on a day, and up to a day before that, you may be able to transmit that illness to those that are around you. And you'll continue to transmit it or be contagious for about 5 to 7 days after you become sick. Young children especially, as well as those that are severely ill or immunocompromised, they may even be able to infect others for a longer time period past that initial 7-day window. basically, what are the benefits of getting the flu vaccine? Well, the flu vaccine can help you from getting sick with the flu. And if you do get sick with it, studies have definitely shown that you're less likely to have a severe course of it. So even if you're still sick with it, it vastly lowers your risk of hospitalization and of going to the ICU as well. It also can reduce those complications I talked about in our chronic conditions. In certain patients with heart conditions, the flu can increase risk of heart attack. The flu vaccine can help risk or minimize that risk of having a heart attack when you have heart conditions and get the flu. Again, it's going to lower the severity of that infection itself. In pregnancy, it's a wonderful opportunity for the moms to protect themselves as well as their unborn children. Studies do show that infants can actually carry some of that protection against influenza for the first few months of life after birth. So just a way for us to protect, those little ones too. Flu vaccine itself can really be life-saving in children as well, especially our younger ones even. There's lots of studies out there that show that the ICU risk among pediatrics is drastically dropped once they've gotten that flu vaccine itself. And as I mentioned before too, besides helping yourself, you can also help those around you as well, and helping kind of minimize that spread from person to person by being vaccinated. Now, I get a lot of questions too about how does the flu vaccine work? And there's a few misconceptions about it, but basically the flu vaccine uses small bits of either dead virus, what we call an inactivated vaccine, or weakened versions of the live vaccines. Now, currently there's only one live vaccine for influenza called the flu mist, and it's just a nasal spray vaccine itself. Most of our vaccines are all inactivated, which means that it's a shot that will put in the deltoid muscle up on the arm. Now, the way that these small bits of viruses in the vaccine work is that they will help trigger antibodies to be produced to recognize the influenza virus if or when it enters our body. Those antibodies that have been developed, and encouraged along by the vaccine will then recognize the flu virus much faster and kind of head off, again, those severe illnesses itself. The seasonal flu vaccine is designed in mind with what strains of viruses we may see in the coming year. We get a kind of a snapshot or a sneak peek based on what the flu season is like in the Southern Hemisphere. So Australia helps us kind of figure out what viruses they saw and what we may encounter ourselves. And so they'll combine all that data and then they'll pick out the strains that we're expected to see or going to be very close to what we're expected to see in that upcoming season. One of the biggest changes this year is that instead of a quadvalent or 4 strains of different virus variants, this year it's only going to be a trivalent or a 3 virus vaccine. What had happened is, based on all the data points that they analyze, that 4th strain, they actually have not seen re-entering that kind of virus pool in the last 4 years. And so based on that data and kind of following the science behind it, they have recommended that we just do a trivalent this year and not have to worry about that 4th variant, which we're currently not seeing. Now, another question I tend to get a lot as a pharmacist is, who should be vaccinated? And the easy answer to that is anyone 6 months of age or older, with very rare exceptions. But those are the individuals that should get a flu shot. We changed that recommendation back in about 2010 to include anyone 6 years of age and older, because the studies that we were seeing and our hospitalization rates were so much improved across the board for pediatrics, for teens, for adults, for elderly. It just was a huge benefit with very low risk to it. Vaccination prevents and minimizes complications of influenza And that's just why it's so important, especially in our higher risk patients, that we vaccinate as many people as possible just to help lower your risk and their risk as well. Now, I also get a lot of questions too about who should not get it. I mentioned earlier that we'll give it to our pregnant individuals for the mom's health as well as for the babies. We can't vaccinate and we don't vaccinate children that are 6 months of age or younger. So that's why it's crucial for the mom when she's pregnant to get that vaccine so she can pass those antibodies on to her offspring. People that have a severe life-threatening allergy to any ingredient in the vaccine, they should not get it. However, here's the thing that I get asked so many questions about. What about egg allergies? Back in, I believe it was about 2 years ago, they have revised their statement saying that any egg allergy can still get any of the vaccines. There are vaccines out there that are egg-free, but the amount of egg protein that's in the vaccine is so minimal that they say that it is not a concern for our egg allergy individuals. Now, take that, with a little bit of a little caution there too. If you have had a severe reaction to egg products, I would recommend getting your shot at a doctor's office just to be on the safe side. The CDC says that is not necessary, but better safe than sorry. But knock on wood, I've not had any patients that have had any issues with our newer vaccines. So the key thing too is information, working with your doctor, your healthcare provider, making sure that they know if you've had problems in the past. There's certain rare, muscular paralysis issues that some people may have had, due to different conditions. And so those are good people for them to talk to their doctor about and just make sure that the vaccine is appropriate for them. But as I said earlier, the vast majority of our individuals should get the vaccine and would benefit from it. Now, I'll talk briefly about some of the misconceptions that we do hear about it. One of the biggest probably is, can you get the flu from the vaccine? I've heard from multiple people, oh, I got so sick after the flu shot. The reality of it is that we cannot get the flu from the vaccine. Those little teeny tiny particles cannot cause the flu infection itself, that flu illness. It will trigger the immune system, so you can feel run down, you can feel a little feverish, but that's the immune system doing what it needs to do in order to prepare those antibody copies so that we can head off a more serious infection in the future. Timing of the vaccine can also play some role in that as well. A lot of times we're doing these vaccine campaigns, these vaccine pushes for flu vaccines around the time that kids are going back to school. And now we're starting to get a lot of other like upper respiratory infections, colds, sinusitis, things like that are much more common, during the fall months as we're making that shift over into winter and as the kids are back, among the school friends. So another question I get a lot of times, are any of the flu shots recommended over another flu shot? All of the flu shots this year are going to be a trivalent, so no one brand is preferred over the other, except if you're over 65. The CDC has come out and has recommended that anyone over the age of 65 might benefit more with a high dose, vaccine, or there's some other ones that have a little bit of a different additive to them, which make them more effective as our immune system is kind of weakening as we get older. Definitely for over 65, talk to your prescriber, see if they recommend that high dose in your case. I've known a lot of active, healthy 75-year-olds that, they have chosen to go with the normal flu shot and have done just fine. However, if there's any kind of illness, those chronic illnesses tend to be one of those populations that I would recommend doing the higher dose in. Again, if you have any questions, talk to your pharmacist, talk to your doctor, talk to your prescriber, and see how that pertains in your specific case. Another argument I've had from folks too is that, it's better to get the flu than the vaccine, and that your body will mount a stronger immune response to it. The problem with that, though, are those complications with it. By getting the vaccine, we have that shorter, that less severe illness. And so that's where we really see the benefit of the vaccines versus the actual illness. The actual illness is what, back in the day before we had higher immunization rates, we saw so many more hospitalizations, ICU admissions, as well as death from the influenza infection itself. So definitely the vaccine is a much better way to go instead of the actual illness itself. I just had a flu shot last year. Do I really need to get another one this year? Unfortunately, the answer is yes. Over time, our immunity to the influenza virus, whatever last year's strain may have been, does tend to kind of wane and fade away. So we are using that science, that data behind it that we get from the Southern Hemispheres to kind of tailor this year's vaccine onto what we expect it to be. And so there can be some slight differences from last year's version to this year's version. And I'll talk a little bit too about like mismatches on the vaccine as well. But the short answer is yes. Due to kind of changing immune system, definitely want to get out there and get a new flu shot every year. Now, we talked a little bit about why some people don't feel well after it. That's just the immune system kicking in, doing what it needs to do with it, as well as those circulating other illnesses out there. Okay, here we go. What about people who get a seasonal flu vaccine and still get sick with flu symptoms? Again, it's going to be a more mild, easier to tolerate course of the infection, less likely to become more severe, less likely to lead to hospitalization, less likely to miss as much work. So just overall better in general, even if you do come down with it. In previous years, our match between the flu vaccine tends to fall somewhere between about 40% to 60%. Now, even in those cases of where the flu virus has mutated and kind of gone off on its own way, and the vaccine is not as precisely matched, we're still getting benefit from the vaccine. We're still lowering that risk of severe infection and those complications, even in those years where we had only a 40% match, with it, where the projections were wrong and the virus just did its own thing that year. So our vaccinated individuals were still better off, still felt and did better overall. And then the last one, I have had this come up a few different times as well, but can vaccinating someone twice in a year increase their immunity? Well, in theory, yes. However, it's not been worth it. The only time that we will usually do two vaccinations in a given year are when a child is first getting their first course of flu shots themselves. The immunity that we get from the flu shot is going to last anywhere in most individuals from about 4 months in our weakened immune system individuals up to somewhere between about 8 to 12 months in our healthy, young, active teenagers per se. So in those cases, we're not going to see that much added benefit to it. Our flu season usually runs from sometime in October through about March. And so that's when we will usually kind of time the vaccine, is sometimes starting in September, all the way through December even. I know that back in the past, people felt like, oh, it's too late in the year for me to get the flu shot. If you've missed your opportunities for whatever reason, you can still get your flu shot. I've had some patients that have even ended up getting their flu shots in January in time for, say the March, big surge to it. So don't put it off, but if for whatever reason you don't get it, just make an appointment with your doctor. Go to see your pharmacist at your pharmacy. There's going to be numerous locations that will be available to do flu vaccines this year. Most of the community pharmacies out there will all do it. Walgreens, Walmart. I know the hospital will be running in October. They'll have some drive-in flu clinics like we've done in the past. More details to follow on the KSB website, so stay tuned to that for more details there. And then we'll also have some flu clinics out in the surrounding, communities as well. But again, we'll get more information out as the time comes closer. We know what the supply is going to be, as well as scheduling things on those lines. So we'll have those up on the KSB Facebook page as well as the KSB website. Now, flu vaccine is our #1 way to prevent, minimize flu infections, severity of complications, things along those lines. But the other part I want to touch upon very briefly is just everyday preventative actions. We can do these along with getting the vaccine, and these are just going to help minimize our chances of kind of picking up that virus from others as well as passing it on to them. So it makes sense when someone is sick, try to avoid close contact with them. While sick, limit your own contact, with others as much as possible. Cover your mouth with a tissue, especially when you cough or sneeze, throw it away in the trash, and then wash your hands afterwards. If you're not able to, out in the public, if you're not able to wash your hands, again, the good old alcohol hand sanitizer. Better than nothing, just helps to kind of cleanse that virus off a little bit, and just helps, kind of minimize that contact with it. Avoid touching your eyes, nose, and mouth when you're out in public. That's just true for any kind of infectious disease, virus, bacteria-based, whatever you may encounter out in the general population when you're grocery shopping or just out and about. Yeah, especially if you've got small children or school-age children, cleaning like hard surfaces, not a bad way to go either, just to help minimize how much exposure to these viruses and germs might be there. And then the last recommendation is that the CDC recommends that you or your child should be at home for at least 24 hours until the fever is gone for those 24 hours. Of course, if you need to go see the doctor, that doesn't pertain, but staying home from work, staying home from school until that fever's been, fully gone for about 24 hours is a very good way to go. Again, that just helps kind of minimize that exposure to others as well. And of course, when we say fever-free, that would be without any fever-reducing medications. So no acetaminophen, no ibuprofen on board to kind of see if that fever is gone. So we ran through things really quickly here. Just wanted to kind of give you that kind of brief overview, that oversight with it. So I want to thank you for your time and thank KSB Wellness Services for having me here today. I also want to say too, if you have any questions at all about the things that we discussed today or things we didn't talk about, feel free to leave a question in the comments and we'll be happy to answer them for you.